My name is Tuzo Engelbert, working under HISP Tanzania as a project manager, but also leading this project or this initiative of climate and health integration. To begin with, this is actually, when it comes to was one of the interesting projects, because the policy was there that we need to see the effect of climate when it comes to the health-related issue. So we started by organizing or coordinating stakeholders first to understand the scope, what needs to be done. And also the HISP Center was already started going through it and having some of the tools that already developed. So during the stakeholders engagement, it was really quite straightforward because we also showed them like the direction where, and we likely got other partners who also wanted also to collaborate in terms of strengthening, showing the effect of the climate towards health-related disease. And to mention, we are just Ifakara Health Institute, which is one of the research institute, but also the ALMA. And this was actually concerned, they want us also to integrate the climate on their scorecard, which is actually being generated. So for us, that was a great opportunity because we sat together and be able to harmonize our objective and have a common goal of making sure that we strengthen the health information system for the Ministry of Health to use, but also to be able to see how the climate can really affect the health. So one of it during that meeting was also to consolidate or to come up with the one roadmap, how we are able to integrate this climate data into the health system. Because in Tanzania we have the national system, which is based on the DHS2, but we are having also other surveillance system, one being the IDCR and other being the surveillance for the malaria. So because the area that we choose was for the malaria, and this malaria has been collected into three different systems that I've mentioned. However, both of them are also being synchronized to the national system. So it was also to check like how this climate can also be integrated for both of the system. As you can see the diagram here, we showed like we can have this kind of architecture that can really also be able to integrate the climate into these three, but mainly focusing on this national health system. But without forgetting also, we are lucky to have the Tanzania Meteorological Authority, which is actually holding or responsible for collecting local climate data. Despite using the global climate data to just be able to showcase how the climate really affects the health data, but also there was a need also of including the local climate data so that you can have really a picture, but also comparing how this climate also can also be able to inform the effect of the climate towards the data. So during this one, that's where we come to realize that apart from some of the variables that is being needed, some of them, they are not even in the global tool that was being developed by HISP Center, but they can also be obtained from the TMA. So through that, however, we were able to come up with this one and be able to agree how it should be the way forward. But we are still having some challenges in terms of where now can be start getting those data. So first was harmonize or to really come up with the plan that the TMA and the MOH should have an agreement of exchanging the data, in which we started drafting some agreement. But also, how can we get now this local climate data into our national HMIS, our national DHS2? So it has been a long journey having those kind of negotiation and how we can be able to get those data. Another thing that when we are actually having this kind of meeting, what comes to our mind is that, however, they do understand that climate has been also much of the concern when it comes to the health-related issue, but they don't know how they can be triangulated. So what we agreed is that since some of the data, they're still being digitalized in the Tanzania Meteorological Agency, let's proceed with using the global climate data, which is available, so that we can also capacitate the team to understand. Because through the tools that was being developed, that it showed that how you can also be able to predict what is going to happen. But also with the modeling that is there, it also tells you like how this climate has also been able, or you can use them to predict what's going to happen. So that's it is going to really help them, like in terms of planning what are the intervention that should be deployed, depending with what is being observed through the prediction. So for example, since we are focusing on malaria, showing like the case that is going to happen due to this climate. So they can also, for example, the prediction, if it shows like maybe in 3 months we'll be having high cases of malaria, then there should be some awareness to the community that this month it's going to be, we expect to have more cases. So probably the community need to be told to use maybe the mosquito nets to make sure that we lower down those cases of malaria cases. So after we have this meeting, the stakeholders and they've been able to synergize of what need to be done, we are also expecting now to have these interventions or to have these integrations of climate in our national instance, and to start capacity, to start building the capacity to the MOH staff to be able to understand how these two are related and how can also be used, and how these tools is going to help them in terms of planning and come up with the intervention that can help to lower the malaria cases. And it was really, when we were having this meeting, most of them, as I said, they were having this kind of concept of climate and health. So coming up with these tools, because the tools were already there, that was already developed, and be able to show the really cases of how you can be able to triangulate. Yeah, there is a wow factor that happened, like, hey, you guys, you are already ahead. So they said, okay, so what are we waiting? I think we should straight go forward and be able to integrate, because they have been waiting to see that thing happening, and they are lucky to see like some of the institutions, especially HISP Tanzania, with the collaboration with the other partner, HISP UAO, they are able even to come up with a tool that can really help them. So to them was like, everything is ready. What are we waiting? I think we should do. One thing also during this project execution, that still some of them, they haven't seen the necessity of having the climate data into their systems. That's why the push of ministry for the TMA, for example, Tanzania Meteorological Authority, to have the local data, they have been in that push. So we need to create a tool to strengthen the system, to showcase them like this is how the climate, how it's going to affect the data, so that they can also push the local meteorological agencies to be collecting some of the variables that are missing for them to use within their system. Because even meteorological, of course, they are collecting data, but they haven't seen those data being quite useful, being needed by other institutions. But integrating them in health, and the health being able to acknowledge that you are really climate data is helping us to strengthen or to be able to intervene in some of the issues that might happen, then it also strengthens the TMA to be able to collect even other variable that was not seen to be necessary. And during our testing of the existing model that has been developed by HISP UAO, the core team, it was seemed to align in terms of predicting. Because when we were doing the evaluation, it was showing like the calculation or the result of the models is providing is actually going clear to the data that are there. So, but that also attracted the local modelers to actually understand the mathematical, the algorithm behind those models, but also attracted them like how they can also be able to test their model within the tool. So that's the thing that when I was coming here, I was looking forward to understand how they can be able to integrate the local models into this global tool, so that we can also have varieties of models that they can also be used to the other use cases.